Hi guys, so I have an update for you guys. Yeah, I'm back in my car. well, the update, oh my god, I'm feeling kind of hot. It's been a little bit like hard to just like get started and tell you guys what were the results of my latest CAT scan, because even to me sometimes it's a little bit confusing in different ways, in so many ways. So I did a CAT scan, again guys, post-surgery, after my surgery, maybe about 2 weeks ago, and I got the results last week. And I think it's a miracle, right now it's a miracle, independent and regardless of whatever may happen in the future, because I know how this type of diagnosis is, based on research, based on what has happened to other people. I know that, it can be very uncertain, like what will happen next. And the fear, like would this, God forbid, cancer go somewhere other than the place that it was. That is frightening to think about, to be honest with you guys, very frightening. But as far as the results of my latest CAT scan, I say it's a miracle. It's a miracle that the results read back no evidence of disease, no metastasis, and no reoccurrence. That is completely a miracle to me. And when the doctor called me and she told me this last week, the nurse, I think she's the nurse practitioner, she works along with the doctor that I went to for my first opinion on chemo. She called me and told me that, and I was shocked. I stayed silent. I didn't know what to say. I just said, after a while, I was like, after a few seconds or a minute, I was like, okay, that's good. But she did say, although the CAT scan shows no metastasis, no evidence of disease, and no reoccurrence, your CA-125, again guys, which is a cancer marker. I know I've been talking to you guys about the different cancer markers that you can do, the different blood tests, and that's one of them, the CA-125. So she said, because your CA-125 is 12 points above the normal, she said a little bit elevated, and it's 12 points. I'm telling you guys, the range that it should be in is 35 or less. Mine was 47. So they said, due to that, the doctor still wants you to go ahead with the chemotherapy. And again, going with the cancer markers, you can't totally depend on that, because I've read online and like I've spoken to doctors, and even if the number is low, lower than the 47 I had, people could still have cancer. Somebody had an 8 and she still had cancer. Someone could have a way higher one and it's not cancer. So we can't totally depend on the cancer marker, right, of the LDH, ACG, and CA-125, because remember, I told you guys before, I know it's a lot of information, the HCG and the LDH after surgery came back normal, that I had alongside with the CA-125, but the CA-125 came back 12 points above. So the doctor says that she still recommends the chemo, based on the research and people with my type of cancer. The cancer institution, no matter which hospital I go to, recommends having the chemo with the three chemo drugs. Cisplatin is one of them, and then there's 2 other ones, like a BEP, and the P is in the cisplatin in the middle. Um, so yeah, can we come back to the CAT scan? So the CAT scan, although like for me, my feeling as a patient is, although like the CA-125 was, you know, a little bit raised or elevated, not at 35 but at 47, I see what they're saying, you know, like, you know, LaRuby, go get the chemo. But however, like, it's very satisfying to me and a miracle and amazing that, what if everything I'm doing is actually working? You know, all the research that I've done, all the holistic things that I'm doing, all the natural things I'm doing. What if all of that I'm doing is actually working? And that's why my CAT scan came back. No evidence of disease, no metastasis, and no recurrence. For those of you guys that don't know how a CAT scan works, I just want to, you know, give you a quick, like, review. Basically, it's like a machine, right? You're like under a machine and it scans you. And first they take a couple of pictures without contrast, then they put contrast. So that's what they did to me. And the contrast is supposed to be like sugar that you're giving your cells. And if there's any cancer present, then those cells, which are cancerous, are supposed to light up. In my CAT scan, nothing lit up. How do I feel about that? I feel happy. I feel that it's a... Sorry, guys. So yeah, guys, I feel that it's a miracle. Like, that the contrast went into my body, which is sugar for the cancer cells. And there were, in my eyes, there were no cancer cells there because nothing lit up. And again, guys, this is my view as a patient, you know, who's diagnosed with cancer, who has done research, who has met with naturalist doctors. And this is my second time doing a CAT scan. That's a miracle. No, nothing lit up. Can you celebrate with me? Nothing lit up at this moment, right? Now, the doctor view, guys, one more time. They don't share this view with me of it being a miracle. They want me to go to chemo. It's like the standard procedure. You know, you're diagnosed with a cancer at surgery and you're expected to go into chemo after. It's the standard procedure. It's what's been like ruled by the cancer institution. And, you know, I don't want to get into that in this video, but since we're in the topic, I'll tell you guys like a little bit of my view. It's sad because some people die anyways after the chemotherapy. They die. So it's like, why go through it? You know, that's a part of like how I feel, and it just makes me emotional when I think about it, because it's like, you know, if you do it, you may die because it may return. As I told you guys in another video, they said if you do it, the second opinion, it can come back in 2 or 3 years. You have a higher chance of a better probability. If you don't do it, it can come back in 1 to 2 years. So basically it's like, what do you do? It's like, either way, you know, it's a very hard decision to make. And then, you know, like, to feel that the CAT scan like came back that way as a patient, I'm like, oh my God, it's a miracle. And yeah, like the doctors don't share that view with me, and I don't know. I'm sorry, like I hope I'm not making you guys crazy with all of this, but it's a lot, and that's how I feel sometimes. Sometimes I feel like Well, all the time I'm feeling great due to the changes I made in my diet. But sometimes when I think about the chemo and how hard of a process that is, and when I think about what the doctors told me, that either way, it can come back, and the fact that they said that there can be microscopic cancers that you can't see that wouldn't be lit up in a CAT scan. Sometimes when I think about all of this, I just want to cry. I just want to cry. It's my life, my body. I have my girls, and I want to be strong for myself, for my daughters. And it's like, what do you do? Like, do you hold on to your energy and continue to be like plant-based and like do all these things that are good for you? Or do you just go and like submit yourself to a treatment that it's basically metal in your veins, the cisplatin, and the other ones, I don't even want to imagine what they're made of. So again, guys, it's a very, very hard decision to make, and something to think about. It's not a decision to make lightly. And I want to continue to see like how I'm doing with the choices that I'm making in my everyday life. And after I'm done talking to you guys, I'm gonna go make my celery juice. And I just want to believe and continue to believe that it'll be fine, that everything will be fine, and I made the right decision in taking care of myself right now, because I don't think I really was before, but that's another video. I was so busy with work, and I don't think I made myself available to my health as I should have, because guys, I just have to tell you that without our health, we have nothing. Then everything can end. So please, take care of your health. Follow my stories if it helps at all. And let's hold each other accountable, but please take care of your health. If we don't have our health, everything ends. So yeah, those were the CAT scan results that I wanted to share with you guys. I'm sorry for being a crybaby right now, but this is real. This is how I feel, Thank you for listening. And if you know anybody that's going through something like this, or that this video may help anyone that it may help, please like, share, and subscribe. It's not easy to make the decision of going into chemotherapy. It's not easy to receive results, CAT scan results, MRIs, blood work, when you've been diagnosed with such a disease. But it doesn't have to be hard, right? With the right support, with a strong mind, and with eating your vegetables and foods that have cancer fighting properties, and intermittent fasting, at least if we take control and take action, maybe we can feel better. So again, guys, please like, share, subscribe, and I'll be back here soon, and I'll update you guys again. I love you guys. See you soon.